There are many modalities that we offer that primary care physicians often don't think about. In addition to conventional therapy, we have broader options. We can use acupuncture, massage. We can use the idea of dialing down the dimmer switch of pain using mind-body therapies. We can help a patient take care of themselves with self-care, like exercise, yoga, nutrition, and stress reduction. And oftentimes that can have the desired effect without having to use more invasive therapies.
1 in 10 million.
On it, Doctor.
Here, you've got a tricky one.
Nothing we can't handle. Get me some wolfsbane, also known as monk's hood, in here, and a whole tray of flower remedies.
Whoa, your chakras are fading. You need some crystals.
Nurse, fetch me some purple tinted quartz. Damn it, you're right. Make that aquamarine quartz.
Good call.
Okay, he's stabilizing. Now, does anybody know what sort of car hit him?
A Blue Fort Mondeo, apparently.
Right, get me a bit of Blue Fort Mondeo, put it in water, shake it, dilute it, shake it again, dilute it again, do some more shaking, dilute it some more, and then put 3 drops on his tongue. If that doesn't cure him, I don't know what will.
Once upon a time, there was quackery, as I like to say. Quackery was the preferred term used to refer to ineffective and potentially harmful medical practices that are not supported by evidence. Physicians having a grounding in science and prior plausibility, for the most part, understood that things like homeopathy, reflexology, energy healing, and stuff like that were based on pre-scientific vitalism, magical thinking, or science that was either incorrect, preliminary, or confused at best.
Integrative health to me is the best of both Eastern and Western medicine. I'm a Western trained cardiologist, and there's no place I'd rather be than the United States if I was having a heart attack. However, both before and after acute illness, we want to really bring the best of all available therapies, and for that, that's a lot of things that tend to be outside of the traditional Western practices of healthcare. We really try to focus on the mind, body, and spirit approach of health, and we appreciate that our mind is as tied to our physical health as our spirit, and try to bring that all together into one product that is the best type of healthcare for the individual.
Healthcare in America right now is a disease management system. And in order for us as a country, as human beings, to really take the next step and take responsibility for our own personal health, we have to have an integrated approach. And integrative medicine has really given me a basis for questioning the right things, but for focusing on priorities. And I think that integrative medicine does a wonderful job of providing a menu of opportunities that you can take advantage of throughout your lifetime, and that really boost your overall health and put you back in control of what your aging plan might be, what your health care plan might be, and how you can best be as vital as you can at any age.
Integrative therapies are something new. It's a new emerging concept. It used to be called complementary and alternative medicine. But now we've changed the names and have converged it to a integrative medicine, integrative oncology, or integrative therapies, combining the best of Eastern medicine with the best of Western medicine.
When we have cancer patients in the inpatient setting, we have things like medical massage, acupuncture, aromatherapy, and stress-based therapies to help in the acute setting. That helps people with pain and nausea. In the outpatient setting, we have a variety of things to help people's body be in the strongest capacity to have their mind, body, and spirit aligned. Those things include biofeedback, reflexology, medical massage, guided imagery, aromatherapy, acupuncture in that setting as well. These days we have almost a standing protocol for folks going through chemotherapy to have that tied with acupuncture because the results are so much better. When people go through chemotherapy, it can be quite a physical process on their body. Both before and during that process, we want to make sure they're as strong as they can possibly be. Through elements like acupuncture and aromatherapy, we can help decrease some of the nausea and pain that tends to go with both potentially the cancerous process alone as well as the chemotherapy. It allows people to be able to eat more and be nourished internally. We've seen through years now of these services that folks who get acupuncture along with their chemo services do much better long term.
Now, after you've recovered from cancer and you're a cancer survivor, one of the things is obviously you want to improve your quality of life. And here's your ability to do it with integrative therapies, whether it be a mind-body medical approach, whether it be learning how to relax with acupuncture, the relaxation response, or massage therapy, whether it's the nutritional integrative therapies, learning what good nutrition is all about, and that's what we do as well. How to eat, drink, and be healthy. And then obviously manage the stress and the anxiety of everyday life.
Let's start with your own story. You were 31 years old, finishing your medical training, and discovered you had cancer. It was really by accident.
That's right. I'm a physician and a scientist, and I was running my own brain scanning experiments. And one night a subject didn't come, so I took his place in the scanner. And my colleague told me, we can't do the experiment, there's something in your brain.
And after that, you underwent conventional treatment, chemotherapy, surgery, but 8 years later, your cancer returned.
That's right. This is a kind of cancer that usually comes back, and in spite of all the best conventional treatment, it did come back. And I had surgery again, and chemotherapy and radiotherapy, and that's when I realized that I had to start using my skills as a physician and a scientist to find out in the scientific literature everything else I could do to help myself on top of conventional treatment.
You really decided you weren't being treated in the correct way.
Well, I realized they were doing everything they could to kill cancer cells, but they weren't doing anything to help my body resist cancer itself. There's a ton of scientific evidence showing that the foods we eat make an enormous difference in terms of how our body can fight cancer. Every day, 3 times a day, they play on our genes and tell our body how to behave. And I realized that the typical American diet is actually linked to a variety of cancer-promoting factors. Yet other foods can slow down cancer. That it's 80% plant-based. It's mostly vegetables, fruits, beans or legumes, and some fish for animal products. Very little meat, very little, a couple times a week. It uses garlic, it uses onions, it uses herbs and spices like turmeric is one of the most powerful natural anti-cancer agents that exist.
Work?
Well, it's amazing. Turmeric actually is a very powerful anti-inflammatory, just as powerful as ibuprofen, and it slows down the cancer process in a variety of ways. It's now being studied at MD Anderson Cancer Center in Houston as an anti-cancer agent in combination with chemotherapy.
And exercise makes a big difference.
Exercise makes a huge difference. Just 30 minutes of physical activity, could be walking to work and back 5 times a week, reduces the risk of recurrence for breast cancer or prostate cancer by about 50%. Now, this is as good as some of the best drugs we have, and you can take the drugs and walk to work. This is not incompatible.
What that also helps with probably is relieving stress, another cancer promoter, you believe.
That's right. Stress doesn't cause cancer. But what we know is that some responses to stress, particularly prolonged hopelessness and helplessness and depression, can make adrenaline go up in the body and cortisol is whacked out, and this impairs the body's ability to resist cancer.
You look really healthy. You're still in remission?
I am, for now. Who knows what the future will be like, but I feel healthier now than before I ever had cancer, which is remarkable.
Having seen many people, both personally and professionally, go through cancer treatments, I know that the best model that we can deliver is really a model that encompasses both integrative therapies and our traditional Western therapies, and that's really where we produce the best cures, we produce the best survivors, and hopefully we prevent the most people from ever experiencing cancer in the first place.